Good morning, ladies and gentlemen. It's a pleasure to be here today at CeGaT GmbH in Tübingen. And my partner today is Mr. Biskup. He's Managing Director of CeGaT. And as I have seen in the internet and also in the press, you are very active also in this Corona business, I would say. My first question is to you more fundamental. What is the founding year, how the company was established, and what are you doing with your company?
All right, well, thank you very much. Thank you very much for visiting us, Professor Lohmüller. Welcome at CeGaT. CeGaT, Center for Genomics and Transcriptomics, is a company that is active in the field of genetic diagnostics. So everything about genetics is our business, mainly the diagnosis of patients. So a typical sample is a patient, young child, for example, that has epilepsy, and the doctor needs a diagnosis. We then receive the blood from the medical doctor. We look at all the genes related to epilepsy. In this example, we analyze the genes and we write a medical report. And this medical report is a diagnosis, and in the ideal case is stating the child, the diagnosis of epilepsy is confirmed because we found a mutation in the gene XYZ at exactly this position. And with this information, the doctor can confirm his diagnosis, can choose the optimal treatment, but can also consult with the family. Because a genetic disease is always related to a whole family, and the question arises, what is the risk of having another affected child if there's another child coming, and so on. My wife and I, we founded CeGaT 11 years ago, 2009. My wife is a medical doctor. I'm coming from the management side, and we started the business 11 years ago. It's still a privately held company, and we developed into, well, this building. This is our building, and we have now 250 people working at CeGaT, and we do nothing else than diagnostics.
Yes, and the main headquarters here in Tübingen.
This is the main headquarters here.
Yeah, okay, good, excellent. Yes, that means a very fast growth, and I would say also a success story, also for Tübingen, of course. And what I have also seen that innovation is the key, I would say, also for your growth.
Absolutely so, yes.
And that means, what was the nucleus of this idea to found the company?
Well, the central idea is to have everything in-house. The technology that is developing very fast with respect to sequencing, then all the medical, the biological expertise, and at the same time bioinformatical expertise, because we handle terabyte of data per day, and we combined everything, and so we were able to kind of get into a new area of genetic diagnostics by what we have been doing 10 years ago. So we were really pushing the envelope these days, and of course we always try to be first in the field, be very innovative, develop better and better products. And if I say products, it's a medical report, it's a diagnosis for a patient, but we improve it continuously. And this is, I think, our strength.
Okay, that means, from my understanding, if you do these genetic diagnostics, that means there are laboratory work, but also I think you need a lot of IT infrastructure.
Absolutely, correct. And a lot of expertise in the field of genetic diagnostics from a biological side. What does a variant, what does a mutation mean from a pure biological point of view, molecular biology, but also from a medical point of view. To give you an idea, about 50% of our people have a PhD.
Okay.
Yeah,
Okay.
and this is quite a bit.
It's quite a high number.
250 employees. This is a rather high proportion.
That always on the track what is going up in the science and also to be up to date with the technology.
And at the same time we publish our data, always together with the clinicians. But we have about 20 publications a year, because we find new variants, we find new associations.
Okay.
And this is also.
And these diagnoses, and maybe also speak about clients, they are coming from Germany, or are you working internationally with your services?
Oh, we work internationally, of course. Yeah, we are very well known in Germany, of course.
Yes.
But we have international clients from South America to Australia, absolutely so.
Okay.
And we have a sales team that is mainly based in Europe, in all the different European countries. And of course, information is needed, contact to local clinics is needed. Understanding the local needs, understanding the healthcare system in Sweden and Poland and so on is necessary. And this is, of course, mandatory that we have a person.
And what is the process? For example, when I'm in Argentina, I have some genetic material. That means I will send it to you, and then by plane or other distribution channels, and then you're doing the analysis here in Tübingen.
Exactly. Exactly.
Okay.
DNA is very stable, so it's easy from a logistics point of view.
Oh, okay, good.
Yeah, so, well,
okay.
You know, we can still look at mammoths or whatever. Yeah, so no problem at all.
Okay.
What is very important is, of course, the patient consent. So we would never analyze anything without a clear consent from the patient saying, I agree to a genetic analysis. I cannot take your empty cup and run a genetic analysis. Well, I could, but I'm not allowed to, and I should not do it, and I will never do it because I do not have your consent to do it. So this consent is very, very important.
Good. You mentioned also you are still a family business working together with your wife. And what I have also seen internet, you won several prizes in the past. Also your wife for women innovators. What were the criteria for these awards?
Very often innovation.
Innovation,
Of course, you mentioned that. And I mean, really pushing the envelope in the field of genetic diagnostics. We were really the first in the field to run. I have the example of epilepsy. And we were the first to run a full epilepsy testing. Before us, it was kind of gene 1 is tested. Half a year later, medical report. Gene 2 is tested. Half a year later, medical report. All of them usually negative, not finding the genetic disease. We managed to run 300 epilepsy genes at the same time in very few months. So we were faster, we were less expensive, and we managed to help the patients by this technology step.
And also what I've understood, that means the innovations are coming from I would say high qualified staff. That means 50% PhD. That means when there is an idea coming, how long does it take to implement it in real processes, I would say?
Very important. I feel that all our staff is highly qualified. The mentioning of 50% PhD is just to give you an idea of how science-driven the business is. We have excellent people with a PhD and we have excellent people without a PhD. Just to make that very sure. I'm very proud of the workforce. And it's a people business. We need good people, we need loyal people, we need interested people. Interested in really developing new things, making sure that the quality is perfect, and so on and so on. With different skills, of course.
Maybe a final question also to your daily schedule. That means as a managing director, I could imagine you are a lot of meetings, in communication. What do you think, how many time of your time you are in meetings and communication, and how many of your times you are working on maybe computer or other things? Do you have
I would honestly, I would say it's like 60 to 70% communication.
Communication, okay.
Yeah. Mainly on the telephone.
Oh, okay.
We have a very good management team here in-house established, and they do most of the daily business.
Okay.
Which is very important, and they make decisions.
Yes.
So it's not that I need to make every single decision. Then I would be the bottleneck, of course. And so I can work on concepts, on strategies, on certain things, and I think I can spend about 30 to 40% on that.
On that, okay, this is very good. Yes. This is always a point of discussion with other CEOs. What kind of time you are spending for these and these activities, but then you have a really good structure. And what I have also heard, the management team is really an important issue to bring the company forward.
And I trust my management. I'm trying to avoid micromanagement.
Okay, good. This is also good. Maybe from my point, what is the timeline when you get engineering material? How long does it take to do the analysis and give the feedback and the report to the patient?
It depends a little bit, which is the usual answer.
Yes.
There are some very urgent cases. For example, if there's a prenatal case, something in the ultrasound looks weird, looks suspicious, and we get material from the embryo, from the fetus, then we need to be very, very fast. And we have a fast track and do this in a few days. If there are tumor patients, tumor is a big business. Every tumor is a genetic disease, not inherited, but from a genetic point of view, a tumor is different to the rest of your body, otherwise it would not grow exponentially. For tumor patients, we are also very fast because a therapy needs to be given as soon as possible so that the growth is stopped, ideally. So we do this in, let's say, 2 weeks. So in our usual turnaround time is between 1 and 4 weeks.
1 and 4 weeks. Okay. Good.
Sorry for the long answer, but
no.
I think it's important to point it out.
It depends on, it is always the point in many businesses, I would say. What I've also understood, and you also mentioned it, that means quality management is a key issue for your services.
Yes.
Maybe you can say some words how you organize it and what are the main criteria for quality management.
Quality is key, absolutely key, because when we write a medical report, that is something that is associated with that patient for his life. It even reflects on his children or on the family, or on her children and her family. So quality must be right, and we need to do everything to not mix up samples, to not write a medical report depending on the mood of the person looking at the data. So we have very, very clear processes, very well defined SOP. We have a quality handbook from the very beginning, and we are of course accredited according to the European norm, which is the EN norm, but also to the American norms, CAP-CLIA. And we feel that is very important, and the full lab and the full processes are accredited. And that is indeed something that I criticize in Germany, because this is not mandatory.
Really?
It's not mandatory. We have clinics, university clinics, Tübingen, for example, they are not accredited according to certain areas of genetic diagnostics.
This is really
and
new
this is honestly, it's a shame that this is not mandatory. I have a hard time understanding that. Okay, this is also very new information from my side, because I knew also Tübingen University is a very good one, but that means the quality is there, but certification is the other question. No doubt University Clinic of Tübingen is a very good university. I'm not saying they are not. I'm just saying the genetics department.
Okay, this is specific.
It's a specific department. They are offering a similar analysis, and they are not accredited.
Okay.
And that is something that is difficult to understand,
Yeah.
but this is not a uniqueness here in Tübingen. This is widespread in Germany because it's not mandatory by law.
Okay.
And
Good.
it's not requested if you request reimbursement. And so it's and I don't understand that. I think this should be mandatory.
Good. One question, especially to the new challenges because of Corona, that what I have seen, you also have expanded into other areas. That means also in this Corona diagnosis. What are the challenges there, and what kind of business activities you are doing in this area?
Okay. Well, thank you for mentioning Corona. First of all, we are sitting here because we both had Corona.
Yes.
And really regularly. I had it in March already, so four months ago.
Okay.
5 months? No, time is running. 7 months ago, I was one of the first here. I still test myself regularly on antibodies. And on T cells, and I have specific antibodies and I have specific T cells, so I cannot do anything to you, I cannot harm you. You already also had it, you mentioned that. I hope I'm allowed to say that.
Yes,
otherwise you need to cut it.
I was in this fitness club 1st of October in Tübingen, where I was infected.
So this is why we are sitting here without a mask. Otherwise, of course, we are wearing masks and have very strict guidelines here in our company with respect to hygiene and so on. The technique for Corona testing, it's very often discussed publicly. PCR, polymerase chain reaction, is a technique that is also used in the field of genetic diagnostics. So this technique, we are doing it for 10 years now. So it was no problem at all to set it up for the application of Corona testing. This was natural. What were the challenges? Well, the challenges were the timeline. We were asked by the local government of Baden-Württemberg to do the testing at Stuttgart Airport. And we did it. And at the same time, we learned how Bavaria was doing. If you remember that.
There were some difficulties.
Big chaos. And we wanted to avoid that, and we had 1 week to prepare it.
Very short time, yes.
It was on a Friday, and on a Thursday we started.
Excellent.
And we knew there were all the people coming back from vacation, Reiserückkehrer. And we had to test 1,000 to 3,000 persons per day. And we built up the capacity, we built up the processes, we built up a LIMS, Laboratory Information Management System. We built up the computer terminals that we put there within less than a week. We could do it because we had all the expertise in-house. And then we were able to provide a one-stop solution, if I may call it like that. So we take the smear at the airport in Abstrich. We ship the samples, we generate the barcodes. At the airport, we have the data of the patients. All the data are transferred electronically to here, attached with the barcode, of course. We run the sample in the lab. We generate a medical report. We send the medical report to the patient. Well, we always call it patients, to the person that are being tested. We inform the health authorities, Gesundheitsämter, in case there is a positive patient or person being tested. And so we were able to do the whole process.
And the whole process is 100% digitalized. That means this is what I've also heard in other countries. Maybe we're still with facsimile and all these.
No. This would result into chaos. This is asking for trouble. And this is why we were very, very keen on having everything digitalized from the very beginning. And really, 2,000 pieces of paper per day. You don't want to receive that on a daily basis. And if you screw it up somewhere in the process, and then you need to resort it and look for something. That ain't good.
Good. In these challenging times, I would say Corona testing is a key issue, and I would say also there are limitations in capacity You mentioned you are offering some services. What kind of service are possible here in your company?
Yeah, we do. Thanks for asking. We offer two kind of services, answering two kind of questions. The one question is, do I have Corona at this point of time? So this is what we would call Corona testing. And the other question is, did I have Corona in the past? And then we test for antibodies. And we offer both tests. And what we learned in the past is that it is rather difficult to get such a test. Or it's kind of awkward and time consuming. You need to go to a medical doctor. You need to get it, not an update, an appointment there. You need to wait at the medical doctor's office. Maybe you need to even get back to the doctor to get the result. And we have established a very easy to access pipeline. We have our container or our Arztmobil. It's a mobile practice. Where we have medical doctors, where we have medical staff. You can just come here. You can either get a smear for the Corona testing or a blood draw for the antibody testing. And we send the result directly to you. It will be there the next day. So the
very
information
fast.
is very fast. And of course, this is on a private pay basis, but we have very, I think, fair prices. The price for a Corona testing is 65 euros. So it's about half of what the competition is offering. And for the antibody testing, it's 25 euros. So it's easy, accessible,
very attractive,
high quality, and a fair price, because we want to make these tests available to whoever needs it.
And 24 hours for a Corona test is very fast, because I waited for 3 days to get the results. And this is a very time where you always think, what's going on? Do you have it, yes or no? This unconscious is very difficult.
And this should not be the case. Of course, the 3 days you should be in quarantine. But if you are an employer, for example, you don't want your employees to be 3 days quarantined. You want a clarity, security as soon as possible. Ideally immediately, or after, let's say, 24 hours. And this really saves time. And people can return to work faster, for example, if the report is available after 24 hours. And this is why we have established the service.
Maybe this point, digitization, is a good point. What are the challenges for your daily business actually? That means, we can sit together, but I would say maybe it's much more our virtualization and also virtual meetings. What were the changes in the last month in this area?
Probably similar to other companies. We're setting up home office places as much as possible for all the people working at the desk. For example, analyzing data, programming software, no problem. They can work from home, and we put them into 2 teams so that the teams never meet. So if one team has an infection, the other team is still up and running. The problem for us is, of course, the laboratory. Home office is not possible for laboratory, so we needed to introduce a shift model where one shift starts very early to noon, and the other starts in noon and to late evening, and so that they preferably do not meet. Or as short as possible, because sometimes a handover is necessary,
of course,
and we are trying to reduce the risk wherever. With all the typical measurements and actions that are well known, from wearing mask, hygiene concept, disinfection concepts, not meeting in meeting rooms, having lunch with separated places or distances, and so on and so on. So the typical concept.
The typical concepts also here in your
company. And we try to reduce risk as much as possible, knowing that it's always a gauging. You cannot reduce a risk to 0. That is impossible. But you should do something that you need to accept a certain risk, and we are aware of that. And of course, we regularly test our people, of course, especially if they are if they see customers, if they see patients,
Yeah, yeah.
and on the other hand, you need to have the business up and running. Yeah, if you reduce the risk to zero, there's no business anymore.
Of course.
So it's kind of a trade.
It's always a balance. Yes,
it's a balance. It's a trade-off. It's a gauging. Yeah.
Good. Okay, thank you very much for these very deep insights into your business activities. What I have also understood, also in Germany and worldwide, industry is different affected by this corona crisis. What I hear from your words, for you it's more work and more activities, I would say, especially in your business in the healthcare area.
Well, because of corona testing.
Of corona testing, yes.
Yeah. Our typical patient care. Yes. I mean, there's not more tumor patients today, and there's not less tumor patients today. Yeah. So the amount of tumor diagnostics that we run is about the same level.
Same level, okay.
Yeah. So we are not affected too much by corona in our core business.
Core business, okay. Yeah. Good. I'm in the interviews together with also CEOs and manager. I always ask a final question, especially what is the main product and what kind of product or innovation you are very proud of in your company.
Well, today I would say the main product is our tumor diagnostic.
Tumor diagnostic,
yeah,
okay.
It's a tumor panel that looks at a very holistic, from a very holistic point of view, at the tumor of a patient. And we look at all the genetic changes that are possible. It's very holistic. It's a tumor mutational burden, microsite satellite instability, translocations, mutations, copy number variants, it's fusions. It's a very, very good product. And I think it's worldwide the best product for tumor diagnostics. I'm very proud of this product. It's not developed by me. It's a very dedicated and well-trained, highly skilled team that has developed this product. And we have many successes because based on the genetic analysis, we can recommend, and we do this, the best therapy available for a tumor patient. So it's not a trial and error. We can really say, based on the genetics of your tumor, we recommend a PARP inhibitor or this product. This is a very tailored and very specific approach. And this is the product that I think is at the moment our best product. And for every tumor patient, I hope that she or he knows about this product, because it can really help to prolong life.
Oh, that's very good. That's also, thank you very much for this information. That means I'm mechanical engineering, construction engineer. That means it's always a new field, the medical area.
Of course.
Therefore, thank you very much for these insights, and also for the future health, of course, but also success with your innovative products and services.
And thank you very much for coming by, and thank you very much for the friendly interview.
Good. Thank you very much.
Thank you.